Hey, hello lovely people, welcome back to my YouTube channel. This is Glory on Nursekirea once again, and today I want us to talk about copper T or intrauterine device, or the commonly known as the coil. If you're new here, please consider subscribing, and if you've already subscribed, thank you for always coming back. Please watch this video to the end so that you can understand everything you need to know about these intrauterine devices. So intrauterine devices are very flexible T-shaped devices that are inserted into the woman's womb or uterus. So these devices provide contraceptive protection for a very long period of time, or they are long acting. The IUDs also contains two strands or strings that hang from the cervix through the vagina, and these strings are the ones that are used by the doctor or the midwife to check if it is still in situ, and even for removal. There are two types of these intrauterine devices. There is hormonal intrauterine device, and there is a non-hormonal intrauterine device. So the hormonal intrauterine device contains one hormone, that is progesterone hormone, and it serves you or protects you for 3 to 5 years. It is very effective, and it works just like any other hormonal contraceptive. That is, it works by thickening the cervical mucus. It works by stopping the ovulation or the release of an egg. It also thinnens the endometrium, or the inner lining of the uterus where implantation can take place. So for today, I want us to concentrate more on the non-hormonal intrauterine device, because this is the most common and the most used one. This device does not contain any hormone, and it only contains a copper wire that is wrapped around it, and this copper changes the makeup of the fluid that is in your uterus and also in your fallopian tube, and this makes the sperms not able to survive, or it makes it difficult for sperms to survive. So that means if the sperms does not survive, then it means that there is no fertilization, therefore there will be no pregnancy. So this is how this copper T works, or the non-hormonal intrauterine device. So this device is very, very effective. It is considered to be more than 99% effective. It is a long-acting method of family planning, and once you are inserted, or once it is in place, there is no need for you to think about family planning anymore, because this will serve you for almost 10 good years. It also starts working immediately after insertion. That means the effectiveness is immediate, and that's why it is also used as an emergency contraceptive. That means when or if you have unprotected sex or rape or anything that you went unprotected sex and you don't want to get pregnant, or it was unplanned, this copper T can be used as an emergency contraceptive. It is inserted in your uterus within 5 days, and for most effectiveness, it is inserted within 72 hours, and it will protect you maximally. It is considered almost 100% effective when used as an emergency contraceptive. The insertion procedure is very simple and very easy. It takes less than 5 minutes to insert it, and it is effective immediately. Also removed at any time. If you want to conceive, or if you have any other issue, the return to fertility of this device is immediate. That means that as soon as you remove it, then your fertility is okay, and you can conceive any moment from the removal time. This intrauterine device comes along with a lot of advantages and benefits, and it has also side effects like any other thing. And I will be sharing these side effects towards the end of this video. so please watch to the end. So the advantages, one of them is that it is long acting. Once it is inserted, then you don't have to worry about contraceptive or family planning anymore. The second advantage is that this intrauterine device that does not interrupt with sex. I know there is a misconception of that it interferes with sex, but it does not, because the strings that hangs in your from the cervix into the vagina are usually trimmed, and as time goes on, then these strings becomes very soft because they are softened by the mucus, the cervical mucus, and they soften. And the other advantage of this IUD is that the return to fertility is immediate. So anytime you remove it, as soon as you remove this intrauterine device, the fertility is immediate. The thing is that it is easy to use and it is easy to remove. The other thing is that it does not contain any hormones, so there is no much changes in your body as compared to the hormonal contraceptive. The thing about this intrauterine device is that it can be used by all women of reproductive age, including teenagers and also women above 40 years. So it is very safe for women who had miscarriage, very safe for women who had ectopic pregnancy, very safe for breastfeeding mothers, very safe for teenagers, effective for all women as long as they are of reproductive age. Just to understand the side effects of this intrauterine device, and number one effect is that there will be changes in your or in there will be changes in your menstrual cycle or period. And one of the changes is that this intrauterine device might make your periods heavier than usual and longer than usual. So you can experience heavy and long periods, but this lasts you for it may go up to 3 months, but after 3 months, then your period goes back to normal. Also, there might be changes in your menstrual cramps or pain during the use of these IUD. You might experience more cramps or more pain, but this lasts for a few days or few months. The other common side effects of these intrauterine devices is you might experience back pain, you might experience headache, you might have nausea, mood changes, especially if you're using the hormonal IUDs. But all these side effects are there, but they're not harmful and they don't last for a long period of time. The other thing that you need to know about IUDs is that they do not protect against STIs, and these are the sexually transmitted infections, and there are risk factors that you need to consider before insertion of these IUDs. Number one thing is recently and sexually transmitted infection. That is the UTI, urinary tract infection, STIs. If you went recent, then you need to be treated fast because this could worsen due to the insertion of these IUDs. They are also not inserted to pregnant mothers or women, so you need to be certainly sure that you are not pregnant before inserting or using these intrauterine devices. So I think that is all. I end for you today. Please do not leave without subscribing. Thank you for watching, and let's meet in the next video.